Welcome, and thank you for joining us for our Workday Chats today. I'm Keith Lowcamp, Senior Director, Healthcare Industry Strategy, your host for today's discussion. If you have any questions, please share them in the comments below. Today, I'm joined by Marc Perlman, Managing Director at Deloitte, and David Chou, founder, David Chou Health. The past 2 years have accelerated transformation efforts across the healthcare industry. We're excited to dive into key trends and best practices you've observed as organizations embrace innovation to thrive through change. So David, let's start with you. Which imperatives do you think are most pressing for today's healthcare organizations?
Well, there's two main pressing issues that's facing all healthcare organizations currently. One is margins are slim. We're getting to pre-pandemic levels, and we're also trying to figure out how to create better environment for the workforce by reducing burnout for clinicians and non-clinicians. So those two are huge and top of mind for all healthcare organizations.
So Marc, what are your thoughts in terms of the top priorities for healthcare organizations?
Well, as we start really looking towards the future of health, it's going to become more and more important to really unify data and simplify processes across the enterprise. There are a lot of well-known and best practices in HR, finance, planning, and sourcing, which will help the clients have much faster decision-making, be much limber, and bring new ways of looking at the data so they can make the most informed decisions and frankly, help them with really working to increase health equity throughout the enterprise.
And that's really helping to tackle the challenge that David mentioned about the challenge with retaining the workforce and decreasing burnout.
Absolutely.
David, you pressed on a little bit about the pressure on margins as well. What are you seeing organizations do to help address that margin pressure?
I would say the first effort everyone's looking at is reducing waste. So we're all revamping our supply chain. And if you're an organization that's also going through a cloud transformation with their ERP journey, meaning implementing a new system, this is probably the most ideal time to really look at your supply chain operations, because think back to when was the last time an organization really revamped their supply chain? Probably not in the last 10 or 15 years. So we're looking at ways to really look at waste. We're looking at ways to reduce our exposures, and something as simple as gloves. One of the largest expenses for any healthcare organization. We're looking at ways just to reduce that expense. And by tackling where we could have a preference for just the clinicians and by not having so many variations. So something as simple as a glove that's being used throughout the hospital, there's a lot of potential there to reduce the expenses with that piece. And the list goes on and on as we look at the supply chain piece. But I think that's the number one area that we're tackling is how do we cut out the waste?
Mm-hmm. And some of that goes back to, Marc, you were mentioning about bringing together a lot of data as well. And that's got to be key when you're working with clients, when they're looking at improving their supply chain as well. That's probably another aspect of where they need to invest in the value of that data.
Absolutely. When you start getting into the cost-based accounting of what each case rates cost and how it really drives the efficiencies, to David's point, reducing variability is extremely important. And supply chain is one of the greatest areas to actually start saving money, reduce the variability, and also help make an impact on margin.
Great. Workday recently announced our launch of industry accelerators, our go-to-market strategy that helps companies speed their enterprise cloud transformation efforts and address the increasing demands for digital transformation, particularly around finance and operations. So for healthcare specifically, and Marc, maybe we start with you, why are industry accelerators so important for organizations today? And what sort of collaboration across functions do you think is needed to help drive these innovation efforts? And how can initiatives like industry accelerators help kind of achieve some of those objectives and goals that you laid out earlier?
Sure. And Keith, I guess let's start philosophically. Healthcare organizations, for the most part, are not competitive, and they're very similar in a lot of ways. So what we've developed with Workday is a comprehensive collection of processes that are pre-configured. They're focused on specific processes to where you configure, you don't customize, and really have a proven approach and a bottom line. So through our work with a number of Workday clients, understanding the healthcare organizations, we've been able to come up with these type of pre-configured approaches that allows much faster time to value, allows you to see an end product. So if you're actually going through a configuration, take your users through what they will actually see and say, does it work? Really have a good opportunity to check it. And so you're not starting from scratch, which is extremely important. For instance, cost center setup could be done through these configurations, reporting to where you have your first monthly board packages ready, or HR absence, compensation, benefits, or core HR. Those things are very standardized and would give you a starter kit to get done, and it lowers the cost and gets you time to value quicker.
I love the point you made about the collaboration and really kind of lack of competition. They may serve, healthcare providers are serving different regions, and they're very willing to share best practices and ideas and collaborate to really foster innovation within the industry. What are you seeing from your clients?
It's exactly the same. And as we go from client to client, first of all, the industry accelerators and things along that line will only get better over time, because we continue to evolve the best practices. And as regulatory things change, as the environment changes, as reimbursement modifies, it's going to have to be dynamic. But through users conferences like Workday Rising and other places like that, we're able to share ideas and really start influencing not only development efforts, but also things that will help make a real difference in the day in, day out lives of the hospital providers.
And David, you work as a CIO. How important is it to be able to have things like industry accelerators and help the organizations you work with get to value faster and really be able to tackle some of these challenges that healthcare organizations face?
Extremely important. I mean, Marc said it very elegantly that healthcare is not as competitive. I will take it a little bit further to where most healthcare organizations are not development shop or technology development organization. Every health system probably configures and buy commercial off-the-shelf products. So the idea of creating something from scratch independently is probably not existent, which is therefore utilizing accelerators is extremely important to be able to co-create and get to market faster. So I think this is a trend that healthcare organizations must explore and adopt. And they also need to let go of trying to build themselves and utilize other partners, which is where the accelerator comes in. So I would say this initiative is great, and this is where the industry is needed and where it needs to head to. So great effort there.
Great. And so maybe, David, to come back to you on one topic around really collaboration between different parts of the organization. I think to make this move to the cloud and frankly, really to tackle all the challenges, we've seen a lot of collaboration within the C-suite, right? And the elevated expectations for the CIO to really be able to support the business and help them transform. Could you share some of your thoughts in terms of the importance of that partnership and how you've seen organizations successfully drive that innovation and that collaboration?
I would say the key element right there is you got to have a leader that's going to be the change agent. Sometimes it's the CIO, sometimes it's the other C-suite, but you got to have that main individual that's leading that charge. So let me use CIO as an example. I would say the role has changed dramatically to where the CIO is not just managing solutions. Now we're really managing how to get the organization to where they need to be using technology, but also influencing the organization to think a little bit differently, create new process. So I would say something as simple as moving to the cloud, while technology-wise, that's a very simple task. The CIO needs to drive that. They also need to understand the business operating process for HR, finance, supply chain. So CIOs got to be able to read the balance sheet. They got to be able to understand how HR can influence and create the best experience for the employees. And at the same time, understand how supply chain works all the way down to, in healthcare, all the GPO levels. So, we have to wear many hats. We have to understand the business model. And a successful leader that can do that can really drive that and initiate that change. So I would say that's a lesson that I've learned in terms of how a successful CIO leader can drive that transformation.
Yeah, and sometimes people think that the move to the cloud reduces the role of the CIO. I kind of think that it actually makes the CIO more important because the CIOs now has more time to really focus on innovating for the business and really supporting that transformation and taking away some of the administrative work and put that on the cloud solutions. So Marc, at Deloitte, you're working with a lot of different clients and a lot of different organizations. What are your observations in terms of sort of this partnership across the different functional areas, and what do you think is needed to be successful there?
You're following on with what David said. An IT-led transformation usually is a short conversation. Ultimately, we need to take a look at what is a business-led transformation. What do they need to do to actually improve the processes in their specific areas, HR, finance, on the floors with nursing, onboarding, things along this line, to make it really serve the end user? Because as we've talked about, our staffs are burned out. As we've talked about also, cost of care is more and more expensive, and frankly, the processes are pretty standardized. And the more we can actually have collaboration across and have a end user driven transformation that doesn't focus on what they did before, but focuses on where they can go is most important to take into the next generation. And this is why in cloud, customization is not done. It's configurations. And this allows them not only to have the best practices, but really choose how to make it work closest for their environment. And that's when you transform and have industry best practices and actually drive real results that are sustainable.
Right. And, so as we kind of look forward for the future of healthcare, I mean, we've seen tons of change over the past couple years, but over the past couple decades. Maybe David, I'll start with you. What excites you most about the future of healthcare?
I'm extremely excited because I think every healthcare organization has realized that digital and technology is at the core, right? You could arguably say every company is a digital company, every company is a data company. And I'm starting to see a lot of C-suite executive and board members understand that. So they value that investment, where now you get all the technology leaders at the table, where 5-10 years ago, that probably would not have been the case. So I would say this is a great shift for healthcare, where we're starting to utilize some of these great tools that we're starting to see come to market, and adoption is definitely going to continue.
Yeah, and that's one of the things that makes me excited about the future of healthcare is really that promise of technology. Of course, the innovation that's happening in terms of how we treat patients, how we monitor patients and connect information, but it's also the power to transform business processes and the HR functions and how we engage with employees and how we manage the supply chain, and seeing that transformation, I think, is going to help make healthcare more sustainable in the future as well. Marc, would love to get your thoughts in terms of what's exciting you about the future of healthcare.
Well, if you look at healthcare where it was maybe in 2017 versus where it is today versus where it's going in 2030, what you're seeing is we're going to be going concentrated going from a break-fix medicine society where you're broken, I'll fix you, which is a health system of sickness, to one where prevention and wellness are going to grow quite considerably over time. COVID, as horrible it was in many ways, has actually been a catalyst to help us come up with a more consumer-centric, consumer-friendly, low-friction healthcare system. So if I had to portray out to 2030, I think a lot of the disarray would be coming together. The patient or the consumer would be put in the middle, and we'd be looking at longitudinal platforms that don't basically say you're discharged or you're not discharged. You're taking care of for life, whether you're in an acute scenario, where you're handling wellness, or whether you're looking to have prevention. It's all one comprehensive way of really looking out for your health. And I think this is the digital transformation we're going to go to. Cloud is a catalyst, the ability of looking at supply chain outside of the walls of a hospital to help support that wellness. All of these things have become innovative. We also have to watch out for the new entrants in the market, like your retail stores and pharmacies. But ultimately, it's going to be focused on the consumer, and with luck, we'll hopefully get interoperability.
Yeah, well, I love that vision of really moving from treating people who are sick, but focusing on wellness and prevention, and being able to use technology to help enable that more effectively.
Absolutely.
Well, Marc and David, thank you so much for sharing your insights. I really appreciate your time. And join us again for our next episode of Workday Chats.